So the book is titled Escort in Chief. Yeah? It's basically about my life as a doctor. I've made stories out of the daily encounters. Yeah? Some of them very difficult diagnoses. Some of them diagnoses that come as kind of divine inspiration. Some of them journeys of working with patients through complex and sometimes even uncertain diagnoses. Yeah? Some of them even about my life working at night, sometimes missing the phone at night and being looked around at night. It's just about making stories. It's stories, bringing kind of humanity to what we do as doctors, but in a way that can be understood even by somebody who is not a doctor and can motivate. And the book also has, although it's not direct, it has a lot of information on what somebody can do about their health. When you encounter a doctor, you're supposed to behave, the kind of history you're supposed to give, and also some kind of determinants of health, from economic determinants, social determinants of health, epidemiology of disease. So even people who are not doctors will find a lot of use in the book. So my calls are two. One, health is very important because only healthy people are able to contribute to the economy. One of the major expenditures for our nation is actually on health, and this is a kind of investment. I don't take expenditure on health as an expenditure, it is an investment. Secondly, we like promoting prevention and early diagnosis. Prevention is cheaper, early diagnosis is cheaper. When diseases come late, they become very, very expensive. And that's why you see a lot of groups, WhatsApp groups and fundraisers. Usually those are not people who are seeking early diagnosis. These are people who have been diagnosed late. Whether it's cancer or high blood pressure, it has started, it has spread to other organs and damaged a number of organs. We usually say that a simple case like high blood pressure alone is cheap. But when it comes with one complication, it increases the expenditure 6 times. For example, if somebody has high blood pressure and they get kidney failure from the high blood pressure, the expenditure will increase between 6 and 10 times. So we want to promote prevention and early diagnosis, that even if you're not sick, you should go to hospital and get checked, especially as years go by. Beyond the age of 40, once a year checkup would be important, even if you're not presenting with any complaints, because most of these diseases are silent, and the only time you will find some symptoms is when a complication has already checked in. First of all, we have something we call the Abuja Declaration, that 15% of the budget should go to health. Yeah? In Kenya, only 5 to 6% of the national budget goes to health. So that is less than almost a third of what should be going there. That means there will not be enough supplies in the hospitals. If you go, the drugs will not be there, the lab supplies will not be there, the theater supplies, the nurses will not be enough, the clinic officers will not be enough, the doctors will not be enough, because of prioritization. We have not prioritized health the way we have signed with the international agreements. Usually the government is a signatory to international agreements because health is a human rights issue. And so our government is in breach of the Abuja Declaration, which it was a signatory to. And because of that, then we find our doctors wait for patients who are on the far end of the spectrum. Not, we don't have doctors going to the community, for example. We don't have doctors seeing patients in their early stages. You only get to see a doctor when your disease is already advanced. And I believe if the government got to employ more doctors, then our patients will be diagnosed early, and even the catastrophic expenditure that patients spend on health would go down actually.
There are guardians who bring children who are not theirs, but they have sponsored them. And there is a government that has been sponsoring students. So in that state, government is sponsoring the students certain years, but they were not able to fully support us with that kind of fees. So when we went to State House, or when the church went to State House, we also joined them there. The government owes us an amount of money which is known by government, and a part of it, the president says will pay us part of it so that the school cannot go down. Because if there is a large amount of money that we are not having, that we are supposed to have, and we have provided facilities, we have trained the doctors, they have graduated, they are now working in government hospitals, and they are paying taxes. We have trained the teachers, they are now trained, graduated, and now they are teaching in government schools. What we were asking is that please pay us something so that we do not go down completely. And the president was very good to us. He promised that during the budget and in June, by June, we should be able to be facilitated by government to receive some money out of the large amount that we were asking. We are not asking something that is extraordinary. It is what already government has agreed they owe us as a, as a way. Government owes us some money.
The full amount, is it 2 billion or 2 billion is part of the amount?
2 billion is slightly less than half of the amount.
So what was happening today?
So today we were having a public lecture by one Dr. Bundi Karau, a renowned physician who is also a senior lecturer in this university and an associate dean in the School of Medicine and Pharmacy. And we had invited the chair of Kenya Medical Practitioners and Dentistry Board, Professor Were, to be the chief guest, who graciously sent us Professor Rose Koskei. We were also celebrating a book written by Dr. Karau, titled Escort in Chief. It is a storytelling of a medical journey, how medical students do their classes, how they do their training. It's a journey. From the day you come to the university until the day you graduate and go to help Kenyans or other people, it's a journey. Number two, even a physician, when we go for treatment, the doctor starts with us from day one until the day we get healed or the day the Lord calls us home. The doctor is there with us, escorting us in every stage. That is the essence of the book. But actually, it is written in a language that is simple, although the concepts there are medical concepts. And for that reason, we also celebrated the MBCHB program, which is a program and degree program that trains doctors and surgeons. We have trained the doctors and surgeons in the university for many years, and we have graduated 9 cohorts. That means 9 graduations at least. All those doctors are already working for Kenya, for East Africa, for Africa, and the world at large. We are very happy that our students have stood firm, they are standing well, and they have shown the exemplary team spirit, work spirit, and the studentship in all that they do. I really appreciate our medical students, and not just our medical students, the entire Kenya Methodist University student population is really very well alive to the issues that affect the university education.